Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Surgeries for stress incontinence, colposuspension procedure, colposuspension or burst operation. This is in we have burst colposuspension, Marshall Marchetti Krantz procedure, and colposuspension using the white line of pelvic fascia. These are already dealt. Now we have newer surgeries for stress incontinence. Newer surgeries include tension-free transvaginal tapes. Newer surgeries include tension-free transvaginal tapes and tension-free transobturator tapes are seen. We can do daycare surgeries or vaginal surgeries, or mid-urethra can be suspended. First, in tension-free transvaginal tapes, tension-free transvaginal tapes, these will enter the retropubic space. Then we have tension-free transobturator tapes. These tension-free transobturator tapes will enter via the obturator foramen. But there is no need to enter the space into space of radius, so there is fewer side complications in tension-free transobturator tapes.
In tension-free transobturator tapes, so this is the pubic symphysis, this is the obturator foramen, this is the bladder. Now the tapes will go around the bladder neck and they reach the obturator foramen, that is tension-free obturator tapes. If the similar tapes will go through the neck of the bladder, and if they come through the space of Ritzius. Space of Ritzius is retropubic space, that is the space between the pubic symphysis and the bladder. Then it is tension-free vaginal tapes. Okay, these tension-free transvaginal tapes, because they enter into the space of Ritzius, these have more complications. Whereas tension-free transabdominal tapes, because they enter into the obturator foramen, they have more complications.
So as a result, the best surgery for stress urinary incontinence is tension-free transobturator tapes followed by tension-free transvaginal tapes followed by Bursch colposuspension.
thank you and thank you for watching.